Victorian father Geoff Nyssen had just celebrated his 40th birthday when a sporting injury led to a shocking discovery.
I was jumping up and dunking the basketball, and what happened was in dunking the basketball, my upper humerus bone popped. And I thought, having just turned 40, I'm an old man now, I've probably dislocated my shoulder, an old man injury. But on going to hospital and after having a few tests, we soon found out that it was something far more sinister, that my upper humerus bone had actually completely fallen apart. And given that that's the case, the doctors spent a couple of weeks trying to work out what it was that actually caused that break.
It wasn't until Geoff underwent a bone biopsy that he was diagnosed with a rare form of myeloma, a type of blood cancer that develops from rogue plasma cells in the bone marrow. Epworth Freemason's haematologist, Professor Miles Prince, says a delayed diagnosis is common for myeloma.
Because it's in the bone marrow, it destroys the bones, and so patients often present with bone-related problems. It's not a bone cancer per se, it's the destruction of the bone, and so patients will present, for example, they fall off their bike, might be fit and well 50-year-old, and then he has a fracture. So it's tricky for the GP to diagnose this because they've got to be thinking about myeloma as a potential diagnosis. It can masquerade as a whole lot of other diseases, anything between thin bones like osteoporosis to the causes of kidney failure.
How common is myeloma?
Relatively common. It's not talked about that much. The incidence of myeloma last year, there was 2,600 patients with myeloma diagnosed last year. The average age is 65 to 70, so that means half the people are over 65. Unfortunately, it remains incurable, and so about 1,100 people die from myeloma every year.
When you were first diagnosed with myeloma, what was going through your head?
What was interesting about it is I had never heard of myeloma. I had no idea what it was. It actually, I went and did what most people do is I jumped on Wikipedia and had a quick look at what it was and what my, new life looked like. And I found out that potentially I only had a few years to live. So it was just, utter devastation at that point. You start the day with plans, hopes and dreams, and inside of a 5-minute medical consultation, everything changes. Everything goes out the window.
The average length of survival following a myeloma diagnosis is less than 10 years. But with the support of his family and not-for-profit organisation Myeloma Australia, Geoff has maintained a remarkably positive attitude through a number of challenging treatments.
You quickly come to the realisation that, life is a gift, not a promise. And so what you do is, or what I had to do was I had to find purpose. And so in purpose, I found purpose in supporting fellow patients. I found purpose in supporting myeloma research. But most of all, my purpose is to be here supporting my kids, supporting my family, because at the end of the day, if ever there was a time when I wasn't here, they're the ones that are going to miss me most, and so that's what's most important to me.
Geoff's a unique individual. He is a mixture of somebody who understands what it means to have a disease that's considered incurable, yet has the capacity to carry on life and be determined and be realistic. One of the things that I've learned from him is that the fight against cancer is a fight against time, and it's about new discoveries. And that's really what a lot of patients with cancers are grappling with, is how can they buy more time for the next treatment to come, because treatments are coming incredibly fast.
Having battled the cancer with chemotherapy, radiotherapy and 3 stem cell transplants, in 2019 Geoff was put onto a groundbreaking antibody medication.
Look, it's called daratumumab, and it's being an antibody, it's somewhat revolutionary in that what it does is it actually teaches my immune system how to find the myeloma, as opposed to the old style of chemotherapy whereby chemotherapy goes in and just kills the myeloma, but it also kills your own cells and is detrimental to your body. This drug is far kinder in the way that it attacks the myeloma or teaches your own body to attack the myeloma.
I understand this antibody treatment has only recently been listed as part of the pharmaceutical benefit scheme. What kind of a difference has that made to you?
Well, when I first had the option of receiving daratumumab, the haematologist then told me that it was going to cost me $500,000 a year. The last thing a patient wants to do is to take that money away from the family, especially with myeloma being a terminal disease. There's no promises. So it's critical that, patients get that support.
It has been 8 years since Geoff received his diagnosis, and whilst the antibody treatment is keeping the myeloma at bay, there remains no cure.
I feel really lucky in that my myeloma stayed stable with about 10% of cancer in the bone marrow. The nature of myeloma is that it's a resilient little cancer, and so it does come back and it does rear its head. We hope that it doesn't rear its head anytime soon.
In 1999, we had really one set of drugs, chemotherapy. Now we have over 15 different drugs for myeloma, and there's no reason to believe that myeloma isn't potentially curable.
I certainly have hope because I reflect on the archaic nature of the treatments that I've been through, so I really have a lot of hope. Ultimately, what we want to do is we want this disease to go from being a terminal disease into a chronic disease, a disease that we live with as opposed to dying from.